and then I will hit, I'll hit admit all, and then I'll mute.
Okay, great. Hello, good morning.
Morning.
Good morning, Michelle. Can you hear me?
I can, yeah. Hi, Michael.
Perfect. All right. First nervous minute is over. We can hear each other.
Yep. And I think everyone saw as I logged in that the recording is going. So
Okay.
got that. Yeah.
All right. I've got 9:01. We'll give it maybe one more minute and then we'll get going. So. Okay, why don't we go ahead? For those of you that have not had a chance to meet, my name is Michael Langer. I'm the Deputy Director with the Division of Behavioral Health and Recovery, DBHR, within the Healthcare Authority. And I have Michelle Martinez with me here, who is leading the effort on this committee and will be doing our lead staff work on the committee. So just really want to welcome you all. We'll go through some formal introductions here shortly, but thank you for joining us early on a Monday morning. And we have been looking forward to this day for quite some time. I know our time is short, and we will do a lot of meeting and greeting and kind of setting stage here today, and then kick off some more intensive work starting with the new year. But first and foremost on the agenda, Michelle, do you want to share the agenda? Is that how you want to go through the day?
Yeah, yep, I can go ahead and share the agenda. Do you want me to do those disclaimer slides real quick?
Yes, if you would. Yeah, let's go ahead and start with the disclaimer so everybody knows what we're doing. And if anybody has concerns, let us know, but go for it, Michelle.
All right. Where is that? Share screen. There we go. Okay, so the first thing to know is that this is being recorded. This meeting is open to the public, and it will be posted to the HCA ESB 5476 webpage. And so just keep in mind, this is not a place for disclosing any private or confidential information. And then secondly, if you are here as a member of the public, you are of course welcome to be here, and we want your feedback, but we will not be soliciting public feedback during the meetings, particularly today because we only have a short 1 hour period. And if you have feedback for the committee, you can email that to the 5476 email address, which is hcaesb5476@hca.wa.gov. And I can plug that into the chat for reference throughout the meeting. And the non-committee members will just stay muted for the duration of the meeting today. Okay, I can pull up the agenda now. All right, so I've got that first part done, I think. And so the next thing on the list is to just make sure everyone has received the member roster, which was emailed out about half an hour ago. And the schedule for the meetings, which was also emailed out, I think, a few times over the past couple weeks. The days and times of the meetings will stay the same. The Zoom links, we might be switching to Teams. So if that happens, I'll just swap out the meeting link in the existing appointment, so you won't have to worry about that. And then if you haven't completed your OPMA training yet, please try to get that done within the next week or so, and let me know that when you complete that so I can track it. And you should have also received a copy of the actual bill, 5476, and section 1 is the part of that bill that explains all about the committee and what we are here to do. So if you are missing any of those documents, just let me know and I am happy to forward those on to you. Okay, so we'll pass it on to Michael for intros.
Okay, thank you, Michelle. Again, really appreciate all you've done to set us up for today. And we are going to spend some time now with introductions, and there are quite a few of us on. And for many of us, we have not met one another. And it's even been more challenging, obviously, during the pandemic to be out in the community and getting to know leaders throughout the state. So I will say that we had a lot of interest in this committee. I think there was something in the neighborhood of 120 or 140 applications, and really, really good, solid candidates. And so difficult decisions were made in order to have all of our sectors represented. And so we're thankful that you've agreed to join us, and I hope you feel it's an honor to be part of, because like I said, there was a lot of folks that had interest in this. I think we have, sorry, I thought there was a piece here about, yes, I'm sorry, vacant roles. So before we get into some the introductions, I want folks to know that we still have a couple vacancies, and 3 vacancies, I guess, at this point. We have the opportunity to have 2 young people on the committee with us. These are individuals with lived SUD experience. We've put the feelers out across the state through many avenues. We've yet to have young people apply. And so, you know, it takes a special person to work through the challenges they've worked through and take time out of their day to join us and wanting getting into, you know, adult land policy work and planning work and things like that. But there are folks out there, I'm sure of it, that would like to have their voice at the table. And therefore we have two slots so that they're not all on by themselves. If you know of someone, please let us know. If you know of a couple people, please let us know. We'd like to get the young people to the table earlier than later. And certainly by January, it'd be great to have them join us as we start doing the work. So I would put a call out for that sector. Also, there's a sector of someone who is a worker in our treatment agencies, SUD treatment agencies, that is a union leader. And that we haven't been able to identify that person either, and would certainly like to do that. So if you're familiar, we've made phone calls and inquiries into some of the union leadership, but we haven't had application come forward yet. So if you know someone that is a leader within their union and in this field, please let us know that. We'd love to get that person selected soon also. And then thirdly, a local elected official. We have somebody, I think, that's able to serve today, but they'll be transitioning out in January of their elected position. And so we have a call out, I believe, to the Association of Cities and Counties now to see if they could help us recruit. But if you know of elected official, we have it. We're going to take the next couple weeks or so, hopefully by the end of December, review applications one more time from local officials, local elected officials, and see if we can't get that sector represented also. So those are who are not here today, but many of you are. And again, we're just really pleased that you're taking the time to serve with us. There's a lot to say about Blake. There's a lot to say about this bill. And mostly there's a lot to say about the need for a planful approach to provide services across the continuum of prevention, intervention, outreach, treatment, recovery. This work will focus primarily on that outreach, engagement, treatment, and recovery. And we have initiatives, we have plans, we have lots of work going on across the state to do this now. But the opportunity this committee has is to kind of bring all that into focus in one structured plan. So we'll pull from road to recovery plans and our opiate response plan and a variety of other plans and areas that we don't even have a plan for quite yet. And we'll build something out that way. So that's our charge over this next few months, and or this next year, and we will certainly talk about that throughout this morning. So next up, we actually have introductions of those that are able to be here today, and we're thrilled you are. And I will just go through the list. And what we want you to do is, if possible, be on video, be on camera, and introduce yourself with your name, your affiliation, and then we just have a minute or so, but what your interest is in this committee. What is your passion that brought you to take that step to apply? And what would you like to see your contribution be, I guess, over this next year? So a statement about, I'm sorry, just lost track here. Statement of interest in serving, I guess is how we put it. So the first person I see up and is Theresa Atkinson. And Theresa, I believe you're from the Yakima Valley, but you want to come on and tell us who you are and your affiliation and your statement of interest. Theresa, if you're on mute. If you're trying to speak, you're on mute. Okay, perhaps Teresa's not been able to join us quite yet. So we'll go down. I know our next member is here. I've seen him show up here. So Caleb Banty-Green. Caleb, do you want to say hello?
Hi, good morning. Caleb, I'm at the University of Washington. I'm at the Addictions, Drug, and Alcohol Institute. There's a specific call out for our institute to have a role on this committee. And just to share, our mission is to advance research, policy, and practice in order to improve the lives of individuals and communities affected by alcohol and drug use and addiction. That's super broad, but I think we really try to take a holistic view of addiction. And for my part, having worked in this area for 26 years, I see this law as a potential to sort of have a generational advance in practice, potentially. And I'm really excited about this diverse committee. What we are really seeing in our work is the need to think comprehensively and integrate both addiction treatment with healthcare, with mental health, with harm reduction, with recovery services, that those are all part and parcel of each other. And we need to really transform our system so that services are readily available to people in a kind and humane way. So that is what I will be thinking about as I work with you all. Good morning.
Good morning. Thank you, Caleb. Appreciate it. Next up, there's a question mark after Senator John Braun. So I'm not sure if that means he may not be here, but Senator Braun, if you're on, would you introduce yourself? He may not have been able to make it this morning yet. Let's go on to Hallie Birchnell.
Hi, are you able to hear me okay?
We are, yes. Thank you for being here.
My name's Hallie Birchnell, and I'm the founder and executive director at Compassionate Addiction Treatment in Spokane. And my passion and the reason that I applied to be part of this committee is that street outreach is extremely important to me. I'm a formerly homeless individual myself, and I really got to observe the gaps in care that we have in our community for people experiencing homelessness who are struggling with substance use disorders. So that's why I'm here, and I'm really excited to be here. Thank you.
Thank you for joining this morning. Great to have you here. Next up, Amber Daniel.
Me. Good morning.
Good morning.
My name is Amber Daniel. I am a peer support specialist at Trilogy Recovery Community in Walla Walla, Washington. I applied for this position because I just have a passion for advocacy and for making sure that recovery is available to anybody that wants it, no matter what. And that's the baseline of that. I am a person in long-term recovery. I'm a graduate of Pierce County Drug Court. I've had experience in a lot of these different sectors of the continuum of recovery and receiving those services. And I hope that my experience comes to bear in a way that can help people get recovery.
We're thrilled your voice will be at the table, Amber. Thank you for joining us today. Next, we have Representative Lauren Davis.
Good morning, everybody. I'm Lauren. Super glad to be here. I have significant personal experience with loved ones with substance use disorder, both in my family and close friends. And it was that work that led me to actually shift careers to start working directly in the behavioral health field about a decade ago in suicide prevention. And then I went on to work at the Washington Recovery Alliance. I was the founding executive director and did a lot of work advocating to the legislature around issues related to the substance use disorder continuum of care and creating pathways to recovery for all. And it was through advocating to the legislature that I accidentally ended up being elected to the legislature and continued to do really a lot of the same work around advocating for behavioral health treatment and recovery in our communities. And I was very involved in the Blake legislation, the behavioral health components of this legislation. So glad to be here, honored to serve with all of you.
Thank you for joining us this morning, Lauren. Appreciate your leadership. Next, we're going to go to Victor Delos Santos. Victor, you may be on mute if you're on. Okay, perhaps Victor will join us a little later. I believe I saw our next member on as well, Senator Malika Dingra. Senator Dingra, are you on?
Yes, I am. Good morning, everyone. It is such a pleasure to be here. Malika Dingra, State Senator from the 45th Legislative District, which is the King County parts of the city of Redmond, parts of the city of Woodinville, Kirkland, Sammamish, and Duval. And I chair our Behavioral Health Subcommittee. I'm Vice Chair of Law and Justice. And this was my bill. And in my previous life, I was a senior deputy prosecuting attorney with King County, where I created and chaired the Therapeutic Alternative Unit. So a lot of work around alternatives to incarceration and working on providing access to treatment and services in the behavioral health realm. And very excited to be here. Thank you.
Thank you for joining us. Thank you for sponsoring the bill and for your leadership throughout. Really appreciate it, Senator Dingra. Let's go to Chad Enright.
Chad was unable to make it, so he's informed absence for today.
Okay, thank you. How about Kiera Fisher? Or Kyra Fisher? A moment to get off mute if you're on. Okay, if not, then let's go to Brandi Flood.
Hello, my name is Brandi Flood. I am the Director of Community Justice for REACH, and I run our diversion programs at that office, the LEAD program and the reentry program. And so my focus or motivation to be a part of this meeting is to really, pay attention to trying to have some harm reduction alternatives for people, and really representing the folks that may be picked up for these crimes. So low-level offenders, people struggling in the community, and particularly American folks, and just making sure we have great harm reduction services and robust services to provide to people who may be picked up, and really be able to give law enforcement real direction on what should happen based on the Blake decision. Is my motivation for being here. Thank you for having me.
Thank you, Brandi. Appreciate it. Let's go to Tyler Gagnon.
Morning, everybody. I'm Tyler Gagnon. I'm a person in long-term recovery. I am currently the chair of the Oxford chapter that I'm in. I've opened clean and sober houses out here in my area. My job allows me to work with both addicts and alcoholics in recovery in a work therapy program. I believe that anything that can benefit someone trying to better their life is worth a fight, and I want to do anything to be involved, and that's why I'm here. Thank you.
Thank you, Tyler. Appreciate you joining us today. Let's go to Sarah Gillard or Gillard.
Gillard. Hi,
Gillard.
good morning. Thanks. Yeah. So I'm Sarah Gillard. I work with Greater Columbia ASO as a behavioral health clinical specialist. Prior to that, I've worked in the SUD field for about 15 years, both in an outpatient and inpatient setting with adults and youth. I'm just passionate about being part of this group to be also a voice of Eastern Washington as part of the ASO and representing the 9 counties, and having family members also in recovery and wanting to be part of the group to be a voice.
We look forward to your contributions. Thanks, Sarah, for coming in today. Let's go to Marshall Glass.
Good morning, everybody. I'm Marshall Glass, and I'm representing the health plans. I'm currently the manager of behavioral health at Coordinated Care, and prior to that, I worked for a variety of SUD treatment providers throughout Western Washington. I am a substance use disorder professional and a mental health professional, and really my pursuit of this career is being in long-term recovery myself. I'm passionate about aiding our state in implementing progressive approaches to improve and expand behavioral health services and support for our communities. And, it's apparent that barriers exist that impede access to care. And I'm really excited to be part of this work group to see how we can come together and come up with approaches that really aid our community members. Happy to be here.
Terrific. Thank you, Marshall. We're excited to have you as well. Representative Dan Griffin.
Good morning, everyone. My name is Dan Griffin. I represent the great people of the 35th Legislative District out in the Key Peninsula, Mason County, Thurston County, Kitsap County. I'm a professional firefighter by trade. I will be completing my 30th year as a professional firefighter May of 2022. So it's been a very long career. Exceptionally frustrated over that career on how we've treated and how our substance/mental health system has evolved. I've watched too many people be forced to cold turkey off of their chosen treatment medication. I believe that most people or all people that have substance abuse disorders have a co-occurring diagnosis that needs to be taken care of. I want to bring my professional experience, also my experience trying to care for a substance abusive daughter who's got co-occurring diagnoses, mental health, and substance. I've been involved in the system as a parent and as a professional for so long. I've seen the holes in the system that almost lacks, in my estimation, because of staffing conditions, that sort of thing. It almost lacks a heart. And I'm not saying any of you that work in the field don't have hearts. I know you do, but we have such a big problem that we really have to remember why people turn to substances and the most compassionate way to help them off. And cold turkey is certainly not that way. And I'm here to bring all of my collective experience to get the job done. Thank you for everyone that's serving.
Thank you, Representative Griffin, and thank you for your firefighter service as well. That's a long time. Appreciate that. Let's go to Gary Harris.
Good morning. My name is Gary Harris. I am professionally, I have a 50-year history as a pharmacist. I'm currently retired from active pharmacy practice. I also have a degree in psychology. I served on the Washington State Pharmacy Commission for 11 years as a member and chair. And during that time, the State Pharmacy Commission, under my leadership and with help from Caleb, who provided us information from King County emergency room data, were able to bring the drug Soma, carisoprodol, under discussion, and we made that a controlled substance in Washington due to help from Caleb and also from the assistant DEA director back east. And we were able to do that 6 months to a year before the country made that drug a controlled substance. Also, I was a member of a statewide committee under then Attorney General Rob McKenna that worked on the PMP prescription monitoring program. Governor Gregoire, who was a good friend of mine, I brought this information to her, and with help from the executive director of the Pharmacy Commission, we were able to craft a PMP prescription monitoring program for the state of Washington. Governor Gregoire brought that to the legislature, and it was taken out because it was part of a supplemental bill, but the next year it passed. And so we have a state prescription monitoring program due to the work that myself and a couple others did on that project. One of the most difficult part of my job as the Pharmacy Commission was in disciplining fellow professionals who had substance use disorder. And we had to keep the public safe. And so those people had to have restrictions on their ability to practice and be monitored. And that was a difficult part of my job, but most of those people were able to come back to active practice. I, like everyone else in the country, I have family members and professional friends who are dealing with substance use disorder. And I'm very passionate about helping those people and getting them back to a more productive status in their lives. So thank you.
All right, thank you, Mayor. Let's go ahead and go on to John Hayden. I will do a quick look at the clock. We're at about 9:27, and we only have time up to the top of the hour. So I'm going to go ahead with John, and if we can limit our time to about a minute, minute and a half, I think we'll get through the rest of the folks relatively quickly. So John, please join us.
Thanks, Michael. My name is John Hayden. I work primarily as a public defender here in Port Angeles. And as most everybody here probably knows, a frighteningly high percentage of our caseload involves individuals with substance use or mental health issues. We're lucky enough to have one of the oldest drug courts in the state out here. We had a judge who was very enlightened back in the day. And that has, I think, shown us all that we need to treat a public health problem as a public health problem rather than a criminal law problem. And I'm very excited about the work we're going to be doing.
Terrific. Thank you, John. Really appreciate you being here today. Let's go to Malika Lamont.
Hi, my name is Malika Lamont, and I am the director of the Washington State Technical Assistance Team for the Law Enforcement Assisted Diversion, Let Everyone Advance with Dignity, and also the director of the Voices of Community Activists and Leaders Washington. They are both projects of the Public Defender Association that works to advance social and racial equity and community health through reform of the criminal legal system. And we ground that reform in public health and safety framework. And we develop new strategies and implement models that improve on conventional responses to crime and public order issues. I also am the co-founder of the Olympia Buprenorphine Clinic, which is a low barrier bupe clinic in Olympia, Washington. And I'm very passionate about these issues. They impact my family and myself directly.
Thank you, Malika. Appreciate you being here this morning. And I will leap over myself and go to Amber Leaders, Governor's Office. Not sure if we see Amber on today. Amber, if you're talking, you're on mute. We'll go ahead and come back. Maybe Amber will join us a little bit later. She is representing the governor's office on the committee. And let's go, we'll jump over our HCA colleagues for a moment and go to Alexi Orr.
Hi, my name is Alexi Orr. I'm a recovery coach and youth advocate for a nonprofit called the Foundation for Youth Resiliency and Engagement. I'm here because obviously addiction and mental health has affected me personally and also my son, and the criminal justice system is also something that we have struggled with, and I'm just looking to, I guess, contribute and help in any way that I possibly can. And that's why I'm here. So thank you for having me.
Absolutely. Thank you for joining us, Alexi. Let's go to Cheryl Rasar.
Good morning, Cheryl Rasar. I'm a member of the Swinomish Indian Tribal Community, and I'm the Community Relations Director for Deed Gwalich, which is a medical assisted treatment facility in Anacortes. Why I wanted to be here? I have, family in my community who have dealt with this. I've been a member of the opiate task force, which involved counselors, the police, and wellness people. And I wish to contribute, basically because of my history with my family involved in this. So thank you.
Absolutely. Thank you, Cheryl. Let's go to Donnell Tanksley.
Yes, and good morning. I'm Donnell Tanksley. Most people call me Tank. I'm the Chief of Police at the City of Blaine, Washington. I retired from St. Louis Metro Police in 2014 and moved to the Bellingham area. When I saw the opportunity to get on this committee, I jumped at it. I sent WASPIC an email immediately. It definitely affects my family. Growing up in St. Louis, it's affected people that I know professionally as well. So as the lone police officer on here, I could tell you that I am an advocate for increasing any type of community-based care interventions versus incarceration. Currently, I sit on the Incarceration and Prevention Task Force in Whatcom County and part of the Whatcom County Lead Policy Group. Thank you.
Thank you for being here. And I hope that your communities are finding it a little easier after the flooding up north. And I think you might get a little snow up there today from what I understand, but thanks for being here.
Yes, thank you. It's a few inches.
Few inches already. Okay. I'd be sick. Let me come back and ask if there's any other members that are not HCA members, any other members that have joined us and not had a chance to introduce themselves.
Alex Sheehan here. I'll be on the HCA side. I'll be starting a position as their new behavioral health program manager on the 16th. So I just wanted to come in early.
Okay, thank you, Alex. Okay, I'm gonna go through real quickly, folks. So we're running a couple minutes behind, and just give an opportunity for our HCA staff to introduce themselves quickly. So Rachel Downs.
Hi, I am Rachel Downs. I am an administrative assistant with the substance use disorder team, helping specifically with the 5476 work.
Okay, thank you. And Jason McGill.
Hi, good morning. Jason McGill with Medicaid Programs Division, the Director for Medicaid Programs, and here to help and coordinate with reentry work and Medicaid work and just a general interested partner with this work. Thank you.
All right, thanks for your support, Jason. Let's go to Brianna Peterson. Brianna, your audio is not working too well. Looks like you're on mute now. If you want to take yourself off mute for a moment and give it a try.
Can you hear me now?
Yes.
There we go. Hi, Brianna Peterson, and I am the technical plan developer and report administrator for 5476.
Okay, thank you. Brianna is going to take all of our great wisdom collectively and put pen to paper, as they used to say, I guess, or keystrokes to the computer. But she'll be putting our plan together for us. We're just thrilled to have her on board with us here. Let's go to Tony Walton.
Yeah, good morning, everybody. My name is Tony Walton. I'm a senior project manager overseeing implementation of 5476 at the Healthcare Authority Division of Behavioral Health and Recovery. Prior to that, I was the Criminal Justice Behavioral Health Administrator. So a lot of background working with courts, jails, and other organizations and points across the intercept model in implementing behavioral health initiatives. So very happy to be here, and thank you all so much for making time to be a part of this committee. Very important work. So thank you.
Thank you, Tony. I think we've gotten to everybody. You had a moment to meet Michelle, who's going to support the committee, and myself. Just a word about myself. I've been working with the DBHR, our predecessor organization, since the mid '80s, and currently hold one of the roles I hold is single state authority for substance abuse. And whether it's prevention, intervention, treatment, or recovery, it all matters. It's all important. And we have so much work to do that I continue after all these years to be fired up about this. There's just too much to do. And we need to come together collectively and create a path forward. And I think you've heard me say that a couple times already. So I'm quite honored to be asked by Director Birch at HCA to chair this committee over the next year or so. So thank you for having me, and thank you for being here. We're going to go next into some background around 5476 and the role of this committee. I also will play timekeeper. We're about 6 minutes behind at this stage. And so, Tony, I'm going to ask you to give us maybe a speeded up version, but do your best, and we'll make up a little time at the end here. Go for it.
Yeah, absolutely. And you know, usually it takes about 30 minutes to cover all of the initiatives and programs under 5476. And I'll try to do that in about 5 minutes or 3. I cannot start screen share while other participant is sharing. So Michelle, could you, thank you. So based on the introductions and the fact that everyone applied for this committee and wanted to be a member of this committee, I'm going to skip the background of the State versus Blake Supreme Court decision and the events that led up to the legislature taking on the role of implementing a solution to the Supreme Court decision, as well as increasing all of the other awareness around the issue with individuals with a substance use disorder who are in the criminal legal system. And instead, I'll just focus on some of the other initiatives that are part of 5476, where there's going to be an intersection between the work that this committee does along with the development of the plan. So Section 2 of the bill is the Recovery Navigator Program, and the Recovery Navigator Program is intended to be a statewide expansion of a pre-arrest diversion similar to LEAD or law enforcement assisted diversion. These programs are currently being established across the state, and we anticipate that there will be full implementation of the Recovery Navigator Program by March of 2022. And really, this committee is even tasked with reviewing the quarterly reports from the Recovery Navigator Program and making recommendations about the program design, and basically kind of just watching the progress of the program and identifying any areas where the program could change scope or direction. There's also the Homeless Outreach Stabilization Transition Program. This is expansion of the Downtown Emergency Services Center model, and we will be implementing this in 5 regions starting January of 2022. This is a multidisciplinary team that's tasked with going out into the community and doing outreach and finding individuals who are experiencing homelessness, providing street medicine, and really engaging with them in the field where they're at, and trying to connect them with services while addressing their social determinants of health and making sure that they have access to the minimum standard of care. Well, hopefully more than a minimum standard of care, but at least getting them access to as much care as they can possibly receive. That's going to be a big piece of the work that the committee does, like similar programs, recommendations about how to meet people where they're at, when they're in the community, and having the individual direct the treatment, recovery support that they want. It's a big piece of it, self-directed care. There's also expansion of clubhouse services or peer-run organizations. These will be recovery cafes, similar models ran by peers in the community, and will be a potential referral point for either law enforcement or individuals who are in need of not necessarily treatment, but in need of engaging with a mentor or a peer at a recovery cafe while starting your own path towards recovery. There's also funding for medications for opioid use disorder in city, county, tribal jails. That will be a request for interest will be coming out shortly related to that. There's funding for a consulting contract for recovery residences. We have expanded the opioid treatment network's capacity to include contingency management to some level to address the co-occurring opioid and stimulant use disorders. There was also funding in 5476 for short-term housing vouchers, which went out through our Housing and Recovery through Peer Services or HARPS programs. And then you might have recently seen the request for applications for the Substance Use Disorder Family Navigator Grant Program. This will be more peers, more individuals with lived experience who can help support friends and family of individuals who have a substance use disorder, and helping them navigate the complex system to address their needs. And 41 after. So I just wanted to do a quick summary of the committee and the plan overview, recommendations to assist persons with SUD in accessing outreach, like the programs I was talking about, treatment, recovery support services, and ensuring that there's a continuous, rapid, and widespread access to a comprehensive continuum of care. So really just looking at all the different ways to engage with somebody who has a substance use disorder, the best practices for engaging with them at that point in their life, considering the primary substance of use, and then how to ensure that they have long-term support in their recovery once they've started that journey. There are specific deliverables, including addressing barriers to receiving care, including capacity and where there might not be access points, recommendations regarding evidence-based and promising practices, recommendations towards a diversion and referral framework specifically for that law enforcement piece. As a reminder, this is coming out of the State versus Blake decision. So really making recommendations about the best way for when a law enforcement officer comes in contact with an individual who is possessing a controlled substance to treat their substance use disorder. What is the best way for that law enforcement officer to engage with that individual and make referrals into community-based support networks? And then finally, like I mentioned, the ongoing design of the Recovery Navigator program. Here's the timeline. We're currently into December. We just submitted a preliminary report to the legislature and governor's office, which kind of summarized the steps up to this place, including selecting the committee. And the final plan is due December 1st of 2022. So 2022, it's going to be busy and we have a lot of work to do, but definitely a team of individuals at the Healthcare Authority to support the committee and make sure that you have access to the data, to the resources that you need to make the recommendations related to the plan. Finally, you can find all the resources related to the committee, a full presentation of 5476, a bill summary, fact sheet at our webpage, which I believe Michelle put into the chat. And so that's it.
Well, thank you, Tony. That was a lot of information in a very quick order for sure. I will say, folks, if there is a way of doing a virtual standing ovation, I would be doing it now for Mr. Walton. He has really led. He came on with the Blake passage within a matter of weeks. We got him on. He wore three hats for a while until we were able to hire up the others, but really led a expedited planning process for recovery navigators. As well as assisted Edward, Michael, and others on staff to recruit and hire our staff. And really I lost count of the number of presentations he's done this fall related to Blake and the implementation of 5476. So Tony, thank you so much for your leadership. And we will go from here with the committee. So next up, I think we're gonna have Michelle do some sharing again, and we'll walk through the charter and scope.
Right, let me find that real quick. Let's see. Okay.
While we wait for a moment for that to pull up, you know, we will stay on virtual land here until, and hopefully we're able to open up a bit more with state. And it would sure be nice to be able to meet in person before the planning process is over. I'd say that, but for right now, we'll stay virtual until we get further instructions. What we have up for you now is a charter for this group, so that we can all be kind of working on the same, off the same page, if you will. And so I'll need you to scroll down with me here a bit. Go ahead and stay on top. I'm sorry. I just giving you a heads up there real quick. You can see that the CIRSA committee is from Senate Bill 5476. Thank you, Senator Dingra. Executive sponsors we have down here is Carrie Waterland. She is a director. That's who I report to, DBHR. Committee advisor, Jason McGill. He introduced himself earlier. We want to make sure we stay in close contact with our leadership team with the Medicaid program division. I will be chairing. Michelle will be our administrator. Tony will be a manager over all things Blake. And anyway, we're starting. We had 12-1, so we're just a couple days behind on that. And this will go through currently 12 of 2026. So we've got a lot of work to do this next year, and then we'll see how we track the implementation going forward. We'll keep an eye on that time as we go forward. The purpose is to inform the development implementation of our Washington State Substance Use Recovery Services Plan. And again, I mentioned earlier, the scope of this will be in the realm of outreach, engagement, treatment, and recovery. So that's kind of how we're envisioning what the plan will entail. And we will not redo or duplicate the existing efforts. We will draw those things in. There has been a tremendous amount of work done on the opioid response plan that the state has created, and we've had a lot of local entities or regional entities kind of take that framework and create their own from it. So we would not want to recreate that, but we'll bring that into the fold of this. In terms of background, Tony talked about it a little bit. The Blake decision and the Supreme Court decision, I guess, around Blake in February of 2021, when we all stopped in our tracks for a moment, and legislative members and their staff and governor's office staff rallied to think through in really quick order, how are we going to respond to this decision and our laws around possession, but more importantly, how are we going to take care of people who need services. They need recovery services, they need treatment services, they need outreach, engagement, harm reduction services. And so it's pretty impressive to be able to put a bill together and get it passed to address that when the decision came just towards the end of February of 2021. Who was impacted? Anyone charged and convicted under the laws as written. And then it goes down and talks about some of the statute provisions and when the provisions expire, and then the creation of this committee. I'm shorthanding this a little bit. We have about 10 minutes and I want to make sure we get through it all. But I think most of you have probably had an opportunity to follow and track the Blake decision and this bill. If not, the bill itself was sent out to you, so please take an opportunity to read through that, and we'd be happy to answer any questions you have related to the bill going forward. Let's go ahead and move down a bit. If we look at the project goal, the committee shall establish a plan, as we've been talking about, which will implement measures to assist persons with substance use disorder and outreach, treatment, recovery, as I've been talking. Services that are low barrier. You should emphasize that, underline it, bold it, make it green and yellow or something. Low barrier is the ultimate goal here, right? We want treatment as close to as on demand as possible. Not only treatment, but the other services as well. You don't have to do that right now. That's just an important part. I want to make sure we are low barrier. Certainly person-centered, informed by people with lived experience, and culturally and linguistically appropriate. The plan must articulate the manner in which continued, rapid, and widespread access to comprehensive continuum of care will be provided to all persons with substance use disorder. You know, that paragraph right there is so important. It's challenging. We could have a whole other hour just talking about our workforce challenges in the state of Washington and across the nation. We need more people to do this work. We've got champions in Congress, we've got champions in the legislature, and in the administrations, both federally and in the state, that are bringing forward resources. Quite honestly, in some cases, those resources are being challenged a bit just by lack of staff to implement. And so we need to think about that as well as we talk about the strategies we need to implement. On the good news, what we are hearing are the regional behavioral health administrative service organizations are telling us that initially the recruiting for recovery navigators, outreach workers, and case managers and such, that's going along well, that they're having some success in the recruitment. And so that's tremendous. We want to make sure, even though we're challenged in some other areas, take advantage of the fact that folks with lived experience and peers and others are out there, they're available, and they want to come in and contribute. So that's tremendous. Let's look now quickly at the project objectives. I think at this point, I've got a little note to myself to kick this over to Brianna, who is going to be our writer. And Brianna, were you going to walk us through this part of the charter?
Yes, I will, Michael. So as I read and reread and reread, and probably will read 100,000 more times of 5476 in the plan development, I started to notice a pattern and a flow, and I thought that the best way to tackle developing this plan was to break it out. And so I've broken it out into 3 phases: the information gathering, the formulating, and then recommendations. And each phase has a number of items that are directly associated with the requirements in the plan. So in the information gathering, we will assess the mapping of intersection points by doing asset mapping and gap analysis, and also identifying the current access points. And then in the formulation phase, we will discuss identifying a mechanism for referring individuals, determining new access points, and for creating a proposal for the funding framework to shift resources from the punishment sector to community-based intervention. And then the last phase will be the recommendations, And that will be the recommendations for diversion to community-based care and the recommendations regarding the collection and reporting of the data. And hopefully that will get us to our final report. Now, there are dates included in these. These are tentative, but I thought at least giving us a date has us working towards a goal. So that is my breakdown, and hopefully we will have everything completed by 12/1/22.
Thank you, Brianna. Go ahead and scroll down. So in terms of project scope, develop the recommended actions and potential policies related to outreach, treatment, and recovery. We'll keep saying that over and over again. And review existing co-occurring strategies and plans from other work streams. And I mentioned that also. Out of scope, we will not be spending a lot of time on mental health only services. We will not spend a lot of time on primary SUD prevention services, although they're certainly a really critical part of our continuum. The more we can do to keep young people from engaging in drug and alcohol use, the better off we'll be. So we know those services are important, but this effort will be more downstream or a little bit downstream from that, and start off with our outreach and engagement and go from there. And then budgetary decision making, we won't be making the decisions necessarily about budget in this group as well. We may have some recommendations, but we won't be making any budget decisions. Now, under deliverables, you will see that we need to create our plan, and then we need to look for recommendations for implementing the plan each year going forward. The law may say 12/1. I think it may say that on each year. We put it at 9/30. The reason for that is as this committee does its work and as Brianna and Michelle and others write up our recommendations, it takes about 60 days or so to get through our internal processes within the administration to get approval on reports that go to the legislature. So we can't have our work done in November, Thanksgiving, and expect that it's going to get to the legislature by the 1st of December. Mechanically, things just don't work that way. So we really need to have our work done by the 1st of October each year in order to make that December 1 deadline. Under governance, real quickly, I know we just have a couple minutes. We talked about the executive sponsor and the roles of each of the folks play, Carrie, myself, Jason, and Michelle. Go down from there, Tony and Brianna as well. And then committee members. There's an appendix, I guess, that looks at responsibilities of the committee members also in here. I think that's nearing the end. Oh, we got a couple more here. Assumptions that members will have time to fully participate, and constraints will be stakeholder capacity, timelines, and members scheduling and availability. So we do have meetings set throughout 2022. They're a couple hours each, and we are going to really rely on Michelle and Brianna to guide us through this development. There may be times when we ask you to spend a little more time than 2 hours. There may be times when we have ad hoc work group or two that we need to convene in order to get through a particular issue or two to stay on time. Some of this work, most of it will be done in this kind of committee fashion. There may be some polling, some surveying. If staff bring forward 2 or 3 recommendations, we might need to get your input on those recommendations via email and polling mechanisms. So staff are really charged to create a process that draws the most out of all of you in terms of your interests, your thoughts. And some of that will happen through dialogue, right? So that will happen in these committee meetings or subcommittee meetings. But we really want your best thinking that goes into the plan creation. So let's go ahead and so that, again, the constraint will be member availability. We hope that we get as much time from you as we can. So anything at the bottom, and then we have the committee roster. So I'm going to stop for a moment. I know we just have a couple minutes before the conclusion here. And this is not scheduled, But let me ask Senator Dingra for a moment. Micah, if you're on, as we close out, is there any thoughts you have that you would like to leave us with today as the sponsor of the bill and legislative member?
Thank you. Thank you for giving me this opportunity. And I really do truly want to thank everyone for participating. This, to me, is really a unique opportunity for us to rethink the manner in which we're dealing with substance use disorder. I think we can all agree that the manner in which the state has been dealing with substance use disorder for the last 30 years is not working. And so I really want us to be able to take a look at the data, take a look at practices, not just across our state, but all across the world, not just our country, and learn from the best, learn from what's working, what isn't working. And I ask everyone to be bold, to not be afraid to move away from your comfort level, because science has changed. Our understanding of the best way to move forward has changed. And there may be times that people aren't comfortable with what the science and the data is showing us. But I would just ask everyone to come with an open mind, with a shared goal of ensuring that we are saving lives and that we are treating people humanely. So please be bold, please don't be afraid, but be okay with being uncomfortable. Thank you.
Thank you so much. And I appreciate you playing along with me, even though that wasn't quite scripted, but nice charge for the group. Thank you. That's it, folks. We're at the top of the hour. I know this was rapid fire. We will get information out to you, prepping us up for January and all dates forward. So take care. Have a great Monday and a great holiday coming up. Take care.